Some Arizona students have already started school and thousands more will return to class in the coming weeks. So Arizona's family is getting you ready for that new school year. Jamie is focused on the health and safety of our kids following this pandemic. Good morning, Jamie.
Good morning, Hal. Good morning, everyone. Last year we saw schools going back and forth between in-person and online learning as they tried to prevent the spread of COVID-19. Masks inside the classroom has been a hotly debated topic, even as Governor Doug Ducey passed an order banning any type of mask mandate. So what are some of the health precautions being put in place for students and teachers, especially as we see these cases start to rise once again? We are joined by Lyndsay Hartley, Director of Health Services for the Chandler Unified School District. Good morning to you, Lyndsay.
Good morning.
Tell me about what precautions are being put in place and what students and parents should expect in the classroom experience this year.
Well, this year we still have all of our mitigation strategies in place. As far as social distancing, 3 feet and beyond where feasible, we still have enhanced cleaning schedules and disinfecting high surface or high touch areas. Hand hygiene for students, frequently washing hands when eating and going to the bathroom. We have hand sanitizer available. And of course, masks are optional for anyone, staff or students. And we also, are placing a big emphasis on, exclusion of sick individuals. That's still our #1 mitigation strategy, is making sure that parents keep their kids home when they're sick, and that we, are sending kids and staff home when they're sick.
And that's something that really drive home because, you think, you've got a headache, a tummy ache, go to school anyhow. I was going to say go to work, go to school anyhow. And sometimes it is just starts with a headache. How do we tell if this is a situation where we need to keep our kid home?
That's been the tough thing during COVID, is that, many of these symptoms mimic other things. So really, we have to take the stance that until we know it's not COVID, by being diagnosed with something else, or, the doctor says it's due to something else, or we get a negative test, we really have to ensure that we're excluding that kid until we know. Many of these symptoms can look the same as allergies. They can look the same as a GI sickness. So we really have to work hard at making sure we're testing to make sure kids are negative for COVID before we're allowing them back.
We have so many people who have so many different feelings about this, and then maybe living with multi-generational within the home. What are the most concerned parents voicing to you?
Overwhelmingly, I've heard from both sides, but overwhelmingly, parents want kids back in school. We saw last year that, kids missed a lot of school for COVID and family members that were sick. So, I do feel that a majority of parents want their kids back in school, but they also want to know that we're doing things to keep them safe, which is why, we've kept these mitigation strategies in place.
Okay, Lyndsay Hartley. Have a good school year. I'm sure we'll be talking again soon. When do you guys start back up?
We started on the 21st, so we've been back in for about a week.
Already back in it. Thank you so much.